Hi everyone, my name is Mimi and I will be providing the pharmacy updates for September. This presentation will include information about new FDA-approved medications, a new FDA label change, a recently published article, and a new pharmacy protocol from Cone Health PNT. First, we will discuss some new FDA-approved prescription medications. Inmazeb is an antiviral comprised as a mixture of 3 monoclonal antibodies. It is the first and currently the only medication for the treatment of Ebola. It is administered as a single IV infusion. Veklury, or remdesivir, is an antiviral for the treatment of COVID-19 requiring hospitalization. It is indicated for patients aged 12 and older and weighing 40 kilograms or more. Institutions may vary in target populations by disease severity. There are many treatments for dry eye currently on the market, including those featured on this slide. But Isuvis, a new FDA-approved medication, is the first ocular corticosteroid for the treatment of dry eye. Isuvis is an ocular corticosteroid for the short-term treatment of dry eye. Its place in the market is unknown at this time, but one limitation is that it can only be used for up to 2 weeks. Next, we will discuss a new FDA-approved OTC medication. Sklice is a topical antiparasitic lotion for the treatment of head lice. It recently switched from a prescription medication to an over-the-counter product. There are many treatments for head lice currently on the market, with Sklice only requiring 1 application, and it can be used for ages 6 months and older. Ivermectin is also available as an oral tablet by prescription, but this oral formulation is currently not approved for the treatment of head lice. Next, we will discuss a new FDA label change. Warnings to avoid taking NSAIDs after 30 weeks of pregnancy are already included in labeling, but recently, the FDA has required changes to labeling to recommend that NSAID use be limited after 20 weeks of pregnancy due to the risk of kidney problems in unborn babies. This applies to both prescription and OTC NSAIDs. Now we will discuss a recently published article titled Associations of Cord Blood Vitamin D and Preeclampsia with Offspring Blood Pressure in Childhood and Adolescence. This study assessed the association of in utero exposure to preeclampsia with blood pressure in childhood and adolescence, and whether this association varies with in utero vitamin D levels. Maternal preeclampsia was associated with higher offspring systolic blood pressure in childhood and adolescence, but this was attenuated by higher in utero levels of vitamin D. Finally, we will discuss a new pharmacy protocol from Cone Health PNT. Various guidelines recommend the use of a high-intensity statin for patients with peripheral artery disease, or PAD. Under a new pharmacy protocol from Cone Health PNT, a pharmacy consult would be included in post-operative peripheral artery bypass order sets to increase statin utilization at discharge for patients with PAD. Pharmacists will then be able to optimize the use of a statin or ezetimibe therapy in these patients. In summary, we talked about new FDA-approved medications, a new FDA label change, a recently published article, and a new pharmacy protocol from Cone Health PNT. A special thanks to Dr. Mary Taylor, Dr. Andrea Lipucci, and Samantha Koski for their contributions to this presentation. Thank you.